At MedCan, we believe the future of healthcare is precise, the future of healthcare is preventive, and genomics will play an essential role in the future of health. You hear genetics coming up over and over again. It's a hugely exciting time to be in this field. We're seeing major advances in therapeutics, in the use of genetic technologies for prevention. The genomic revolution is really happening, but it's also really complicated. It's not something you can just sort of look at quickly. It's something that requires in-depth thought, and it's important to kind of take a critical eye. We're really fully focused on the medically actionable side of things. Our program is quite robust. We have 5 board-certified genetic counselors and a medical director. We've been around since 2005. And we look at pharmacogenomics, hereditary cancer screening, which I'll talk about a little bit more, things like whole genome sequencing, tumor testing, liquid biopsy I'll touch on. Moving on to pharmacogenomics, really what we're talking about is precision medicine, right? Getting the right medication at the right dose at the right time. So we know adverse drug reactions cause the system a lot of money and actually cost us a lot of lives. 70% of adverse drug reactions are predicted to be preventable. In terms of pharmacogenomic testing, so essentially at the core of what we're doing is trying to use your genetic information to determine in advance whether or not you're going to metabolize a certain drug normally or not. A 28-year-old male who had about a 2-year history of depression, but was really just managing it on his own. So he wasn't being treated for it. He was just kind of soldiering through. And then he had a major anxiety attack that really scared him and debilitated him in terms of being able to come to work, and he decided to talk to his doctor. So he got prescribed a medication called Trintellix and experienced very quickly, actually very significant weight gain, which he then said was just making him more depressed. He stopped the medication, went back to his doctor who gave him another medication, and he just decided not to take it. In mental health, it is a very applicable test. And so he decided to do pharmacogenomic testing, and this is his report. 20 medications related to antidepressants specifically were not optimized for him. Had he taken that second medication from his doctor, very well could have gone through a few cycles in terms of getting medications that weren't going to work well for him. So he took this report to his doctor, who prescribed medication where his metabolism was normal, and he's doing very well right now. If you have an organization of 10,000 people, about 7% incidence of major depressive disorder. So that's 700 members who may be prescribed an antidepressant. And what we know is that 53% of those people are likely to respond to that first-line therapy, 47% are not. And you have this kind of treatment resistance phase. And so you have 329 members that are going now into this next cycle of trying new medications and weaning on and off. It's quite a time-consuming process. You can't just stop taking these medications. You have to wean up and then wean down. And you basically have a year of trial and error. The costs, and included in this costs, are drug costs, but also productivity factored in here is about $7 million. If you change that, and from the 47% who don't respond to a medication, you then give them a pharmacogenomics test, you can essentially avoid those downstream, that next year of trial and error, and try to get on the right medication. And the predicted savings is around $1.4 million. The other big areas where we see pharmacogenomics quite applicable is in cardiovascular medications. So a lot of the cholesterol medications and blood pressure medications are ones where there is a pharmacogenomic variant that will impact metabolism. The other is around pain. So in terms of pain medications, it's another big area where it is applicable. In terms of pharmacogenomics, I think the debate right now is this a disability tool? Like, is it when you are, go on short-term or long-term disability, should it kick in at that point? Or after you've already had a therapy that hasn't worked, should it kick in at that point? Or is it a wellness tool? Like, should it be offered to everybody who's considering a medication? One of the things we're seeing at MedCan and people opting into this, it's a really high uptake in the young millennial population. A lot of times in people who haven't necessarily tried a medication yet, but they're looking to get some data before they decide what medication they're okay with trying. 1 in 10 people carry a serious health-related genetic risk, but most don't know it. The problem is you can't prevent something that you don't know you're at risk for. So what we launched at MedCan about a year ago was this proactive genetic screening program. People can opt into a 139 gene panel to look at genetic risk for hereditary cancers. So that's things like hereditary breast and ovarian cancer, the BRCA1 and 2 gene, which most people have heard about, hereditary colon cancer, and then also hereditary heart disease. So we have kind of a broad panel, although it can be parsed out and you could just look at cancer or cardiac. So this particular individual is a 52-year-old woman, very healthy, was coming to MedCan for her health assessment to be proactive. She opted in. Her primary concern was cancer, and she also said, you know, it's something that may be informative for my kids, it's something I'd like to do. So the arrow there is pointing to the woman who's 52. So she has 2 daughters, the 2 circles there. Her dad was 72 when he passed away from a heart attack. And on that side, paternal grandfather had stomach cancer in his 70s. On the mother's side, maternal grandmother who passed away in her 50s of some abdominal cancer, but the type wasn't known. This is a pretty standard family history. There's nothing in here that sort of looks concerning or striking. It's kind of the pretty average family history that we would see. What we found for her is that she has a genetic change in something called the MSH6 gene. So this is a gene that's associated with increased risk for colon cancer and endometrial cancer or uterine cancer in women. So her lifetime risk for colon cancer went from a population risk of about 4 or 5% to 22% lifetime risk. In addition to endometrial cancer, which is much more rare cancer in the population, her lifetime risk is up to 26%. So for this woman, recommendations for her is to have a colonoscopy every 1 to 2 years, right? As a standard 50-year-old woman in the general population, she got one at age 50 and wasn't scheduled to get one again until age 60. This significantly changed her screening. Because we know of this risk, she can get a colonoscopy. If they see a polyp, they take it out. You can kind of actively prevent cancer from developing in that woman. And then also in terms of uterine cancer, it's one that some women, if they are postmenopausal, may choose to have their uterus removed. You're kind of actively preventing that uterine cancer risk, or you can consider screening. She came back, we did the results, we sent her for the referrals, and she kind of now has a personalized management plan based on this information. Her daughter came to see us, and she also carries the same genetic variant. So based on the mother's results, it's a 50-50 chance with each child that they would carry the same thing. And that woman her daughter is in her 30s, and she's now starting her colonoscopies 20 years before she would have otherwise, and probably preventing cancer from developing. There are a number of companies in the US who are starting to offer this proactive type of cancer screening as an employee benefit that can help reduce treatment costs, prevent serious conditions from developing, attract and retain talent. I think that was one of the questions that came up earlier, by offering a meaningful benefit to employers and their families. And just to make a note here, genetic counseling is an extremely scarce source in Canada. So there's 350 genetic counselors in Canada. Most wait lists to get into a genetics clinic is about 2 years long. So it's a really difficult specialty to access, and we have some ideas on how we can start to plug away at that, and then improve overall health and well-being for employees, which should ultimately lead to increased productivity. One of the things that we're working on is a chatbot that provides some basic genetic counseling services, and then if at some point someone needs more in-depth discussion, then it links into a virtual consult. This is really important to me and near and dear to my heart, because I do feel like people should have the opportunity to learn about the test before they actually engage in it. So what to consider when evaluating a genetics program. So is the test ordered by a physician? How is informed consent obtained? Can you customize the testing or program to best suit your company's needs? Is the vendor kind of accredited by the right people? How does the program ensure security and privacy? How's the data stored? And what's being sacrificed to provide a cost-effective solution?